like to introduce our short speaker, and he's going to talk on modalities to alleviate chronic health problems, and that's Dr. Gerald Cohen. Dr. Cohen will discuss his integrative approach to healing. After a thorough assessment using cutting-edge laboratory testing, he uses multiple healing technologies such as food, nutrition, homeopathic, functional medicine, chiropractic, and nutritional support for those with traumatic brain injuries. He will also discuss the intranasal light therapy, which can increase internal oxygenation. Dr. Cohen's international practice, called the Center for Healing Process, is located in Menlo Park. It specializes in utilizing whole food nutrition, classical homeopathy, specialized cutting-edge laboratory testing, and multiple healing modalities to aid in diagnosing and determining individualized treatment protocols. His understanding of genetics, epigenetic, and intranasal light therapy has helped him design strategies to deal with the elevation of chemicals, toxins, pollutants in our everyday life that are contributing to the epidemic of disability and chronic disease. For the first time in 40 years, Dr. Cohen has endorsed a product known as the Intranasal Light Therapy, which has repeatedly helped numerous patients heal rapidly by increasing their internal oxygenation up to 40 to 45%. You can visit his website at www.drgcohen.com, and we'll also hear from him tonight. Let's welcome Dr. Cohen.
Or wherever it's convenient. Oh, and reverse 180 there.
That works. Thanks for staying, everybody. Appreciate it. It's probably getting late. How I want to start is to talk about how I approach chronic disease. My practice is now international. I do a lot by telephone. I just came back from Israel where I saw 30 patients. And I have probably a five-fold approach when I see a patient. We do very thorough laboratory tests. Today, in Los Angeles in November, I was at the Environmental Medicine Conference, and the head of the Environmental Medicine asked, how many of you remember back in the 1980s when it was very simple to cure people? How many remember that? In those days, we were getting people well really quickly, especially a lot of times all I needed was homeopathy. That's completely changed. When I talk about my favorite uncle, Robert, when he was born, there was one human-made toxin in the body, man-made toxin, that was lead. Today, an average child that we see, a newborn, has 91 measurable toxins. Each year we add about 5,000 new chemicals into the environment. I'm seeing children as little as 2, 3 now with autoimmune disease. I saw a patient in Israel recently that was 6 years old and she was going through puberty, growing breasts. So how do we approach that? The United States, we're now in autoimmune central. We have twice as much autoimmune disease as any other country in the world. We're about 37th in health. We spend way more than anybody else. We consume over 50% of prescription drugs. We're eating foods that our DNA doesn't have any idea what they are. And so we're playing Russian roulette with the new generation. So how do I approach a patient, whether it's 2, 3, or 4, is to go through their toxic load. Some of the tests that we ordered are full body core toxic load, which include testing solvents, organophosphates, fluorophosphates, all kinds of chemicals. We're finding them in alarming numbers in people, disrupting the normal biology. We also test the GI tract. I'm now finding parasites that was very rare or routine. I just had a lady that was dying and her family flew her in from the Ukraine, and we found the Blastistris hominis in her body. We used to find maybe one every 5-6 years, and we're finding them one every 2-3 weeks. I spoke to the medical director of the lab, and he said that's changed completely. So we're getting all kinds of parasites. We're finding all kinds of conditions that we very rarely see. We're finding everybody reacting to gluten, and usually if you're reacting to gluten, it's because you can't digest proteins. And if you can't digest proteins, you're going to react to other proteins, and particularly dairy. So how do I approach a patient in therapy? I found that doing one thing, in my practice anyway, is not enough anymore. So one of the things that we're using now, which comes out of India, is homeopathy and a plussing method. So if I have a cancer patient, everybody hear me, by the way? Am I loud enough? No. If people can't hear me, I'll talk louder. Okay? Yeah. So the first thing we do in chronic disease is using homeopathy. And in homeopathy, traditionally it was one remedy for one person. That's changed now. So, especially in cancer and autoimmune disease. We're doing what's called the plussing method, and the plussing method changed everything since '93, and these were hospital protocols where we did one remedy in water, a person taking it 10 times a day at regular intervals, one remedy for the condition. If it's a cancer condition, I currently have a patient dying in Israel that's on cancer, on lymphoma, and so she's doing thuya for the cancer, and then we do a remedy for the patient the next week. So I start off that with a homeopathic protocol. What they found in Madras and other hospitals in India that are using homeopathy for cancer, that the results have gone up probably 40, 50, 60%, depending on the cancer. The next thing we use is, besides the homeopathy for cancers, we use nutrition, and I'll show some slides of what kind of nutrition. What I found in the first known idea was nucleic acids. Now, nucleic acids are extracts of growth factors from the cells that are particular for certain cells. The first research came out of Russia in the 1930s, and the first medicines applied for these type of nucleic acids, the first one came out in 1952. Now, what happens when a cell becomes very, very ill, when it becomes necrotic? Does everybody know the difference between necrosis and apoptosis? No. You don't know it? Okay, apoptosis is the way you want cells to die. In cancers, cells don't want to die, they want to be immortal. So they slow down the apoptosis. And what happens is the cells involute become smaller, and then they're recycled for energy. That's normal cell death. In necrosis, we're not designed for necrosis. Now, what happens if you have a toxic gut and proteins leak through the tight junctions and go through the portal vein to the liver? And your liver can't conjugate these toxins and make them water soluble out the kidneys, or make them fat soluble through the bile. The body will put them into the fat cells, and then the fat cells will inflame. This same process will happen in other types of cells. What we're finding in a lot of autoimmune disease, that when they were children, they had closed-end head injuries. So what happens when you have an injury that you can't explain? and nobody asked you and you thought you recovered, what the body will produce, these necrotic tissues that are inflamed, depending on whatever the insult is. It could be radiation, it could be vaccines, it could be poor nutrients, it could be artificial foods, it could be these toxins we talked about. It goes on, all these causes. And these cells explode. They release a protein. Now, what does the last thing the body want? Because you don't want kidney cells growing in the brain, and you don't want heart cells growing in the spleen. So what does the body doesn't want? The last thing it wants is foreign proteins floating in the blood. So it produces auto-tissue antibodies. And these auto-tissue antibodies that are in the blood are designed by the body, and they're always making some. So when you have excess and they stay in the blood, they have nothing else to do except they start attacking the original tissues. So if you have a brain trauma or you have any type of trauma to any of whether it's the liver or any other organ or epithelial cells in the gut or in the skin, it will produce these auto-tissue antibodies. And that's why, you ever know anybody that every fall they get sick with bronchial conditions? That's auto-tissue antibodies making that cyclic response. And the same thing with the brain. When somebody can't explain some of the psychiatric or emotional disorders, it's auto-tissue antibodies. So what we do is we use very precise cellular extracts, which I'll show you some slides on, that are removed. Now, these have to go into the blood because if they're digested, they won't work. So that when we give them to patients, they have to take it on an empty stomach. And we have to give it with a precise fat. Now, they're doing the same thing. Dr. Wiener is doing it in Harvard. He's doing nucleic acids, which are the cellular extracts for autoimmune disease. And he's getting fabulous results 60, 70 years after we started doing it. I consider myself part of the lineage. He's got fabulous results, but it lasts 2 to 3 months. Because removing the auto-tissue antibodies, which this therapy does, doesn't heal anything. That's where they get it wrong. They're also doing it in biotech. They're calling it oral tolerance. All that does is take away the interference from healing. So that you still have damaged tissues, you still have necrotic tissues, but you've taken away the interference that prevents you from the tissues to heal. And only proper nutrition, specific for those type of tissues, can actually rebuild the tissues once you take the auto-tissue antibodies. The third thing that we use is very specific nutrients to open up the detox pathways. Now, if I have a patient and he has a toxic gallbladder and his bile is, or her bile is too thick, it's not going to take away the fat-soluble toxins. They can't get out, so it comes like sludge and backs up, making it a reservoir for further disease. Same thing with the kidney. If you can't conjugate, and glutathione is one of the important things, is there's 6 pathways, some scientists say 8 pathways, to conjugate to make it water-soluble to go out the kidneys. So if you have a blockage there, the toxins will try to get out through the skin, or otherwise they'll start to store. So we use, especially in cancer patients, we use very precise herbs and with very precise whole food and nutrients to facilitate that. The other aspect that I do is enzyme therapy. Now, all cancer cells and many autoimmune cells, and remember autoimmune cells, when you have autoimmune disease, they never stop at one disease. They go in 3s. So somebody coming down with diabetes could very likely come down with MS or lupus. They just progress. So in cancer cells, there are fungal tubules between the
the way cancer cells communicate with each other. So we use enzymes grown on funguses to break up that communication. That's another aspect. And I've been in practice over 40 years now, and I've never endorsed anything. I'm just very independent. A friend of mine, I learned about light therapy when I was studying neurology about 12 years ago. And it used to be it was done by the Russians. And the Russians discovered that certain light frequencies would have profound curative effects on many, many conditions, including it would, by separating the red blood cells so they can carry more oxygen. So this therapy was been around, but it was invasive. It had to be done through a needle, and it had to be injected, the light therapy. And there were certain wavelengths that worked with the Russian. There's tons and tons of research on that. A lot of it, most of it mainstream, a lot of it from Russia and China, but a lot of it also from Harvard. And they're actually doing similar research at Stanford in optogenetics using light. So that's part of my therapy. I have about 100 patients all over the world now on intranasal light therapy. The World Health Organization said the number one nutrient deficiency in the whole world is oxygen. They also announced last year that we're officially now in the post-antibiotic age. And I'm seeing patients now that have been under antibiotic therapy for many years, and they're not working anymore. And that's how they get to me. So with these patients and with these children, we just had, on Friday I found out we had a type 1 diabetes, a 12-year-old that's no longer insulin dependent. So you can revive the cells as long as there's some beta cells left. Okay. That's a little bit about me. That's the original protomorphogen, which is what they called it in the 30s and 40s and 50s. The idea that when a necrotic cell is damaged, it will release these growth factors, and they will go into the bloodstream, and it becomes an antigen antibody, and then the mast cells release histamine. That's why when I have a real sick child, especially a 2-year-old, I had one today actually, she's reacting with high doses of histamine because as the antibodies are neutralizers, the more necrosis you have, the more histamine is released. That's why people sometimes say they feel for a day or two. When they start getting treated, they feel like they're coming down with the flu, but they don't. These are the links with cancer. We found a lot of these in the local tissue fluids as nucleic acid. They're wrapped in a phospholipid wrapper. A lot of it, all the initiation is from the irritation and the inflammation. So all these conditions that we're seeing as an epidemic. And MIT recently said that chronic disease will, within a decade or two, will bankrupt the United States, as we can keep these people alive, but we can't cure them. We can't make them functional. So a lot of times, and also what's changed in science is that we used to think that you get rid of the inflammation, you recover from the flu. Now they're saying that the inflammation stays a lifetime, initiating these processes. X-rays. To remove these local PMGs for its natural tissue antibody activity, you have to have a strong immune system that recognizes them. And you can read about the cancer cells and the embryonic competence, which prevents the PMG acting as an antigen. So in a lot of times in cancer, you don't have the neutralization of the growth factors that are triggering the cancer growth.
What's PMG?
Protomorphogen. But the way we use it, that's old language. The way I understand it, it's growth factor or nucleic acids. They're extracts. So they've found also a lot of intense local accumulation of the PMG or the nucleic acids, and it does not inhibit the mitosis as it does in normal cells because the PMG regulation mechanisms are altered. There are factors which depolymerize an intracellular PMG, thus preventing the normal feedback. Cancer cell PMG is similar to the normal PMG, but cancer cells are not inhibited by it. So there are extracts of nucleic acids. These nucleic acids are the same for every mammal, so you can take it from one mammal and use it to inhibit the growth factors in another mammal. Cellular growth factors are determinants that regulate function, growth, and replication. This is not a glandular, and it's not a desiccated, dried product that people are using. These are very precise growth factors that are extremely fragile. And so it's a very difficult to extract them. Nuclear proteins from guidance physiology, special types of proteins are present in different parts of the cell. Of particular importance are the nuclear proteins present both in the nucleus and the cytoplasm. They contain DNA, and so when the proteins leak from necrotic tissues, remember we're not supposed to have necrotic tissues, DNA floats around. I have one patient now, just one, that's a teratoma, which means that he has tumors growing from the wrong parts of his body because he couldn't inhibit it. And the tumor is shrinking with our care. So these are more definitions from Merck and Mosby's Medical Encyclopedia. This is a slide, we don't have time to go into it, how they're released by the cells, they're put in the connective tissue, and they're released by estrogen, testosterone, epithelial, fibrolysin, thyroid hormones, and blood trypsin. They become wrapped in a phospholipid, and they go into the cycle. Intranasal light therapy really helped my practice because it made treating people, especially very, very sick people, most people are oxygen depleted, as we talked about, especially very sick people. Cancer hates oxygen. So what we've been able to measure, we've also measured in HIV positive AIDS patients that the CD4s go up as much as 40%, 45% after a treatment. We have no long-term studies if it stays that way. So we have a lot of HIV positive people with doing this on a regular basis. The science of intranasal light therapy, why the nasal cavity? Because the nasal cavity is the only place besides under the tongue that you can access the bloodstream directly, and the ethmoid bone is extremely thin, so you can stimulate the growth factors in the hypothalamus, the pituitary, and the pineal glands directly with the light therapy. We see a lot of normalization of the type B lipid in chronic diseases. We see dramatic blood improvements. I didn't mention that we also do blood tests, especially the VAP tests with patients, and there's different selections and benefits for which patient. Background of intranasal light therapy. In 1981, Russians discovered this through intravenous blood irradiation therapy. They injected the red light into the veins. They found amazing results and a reversal of these common modern degenerative diseases. Tremendous improvement with dementia, circulatory diseases, neural diseases, and chronic diseases. And Lou Lim, in his research facility in Canada, started researching this and designing these for and manufacturing the parts in Malaysia. He was curious why the red light worked and how to deliver it in a cost-effective way. There are over 3,000 clinical studies We haven't found any major side effect. It targets the central nervous systems, lowers blood sugar, improves quality of the blood lipids, helps lower tissue autoantibodies we talk about, promotes tissue repair, increases growth factors, reversal of myocardial dysfunction, reversal of hemoglobin A1C in diabetes, and all these we're seeing in my practice using this, plus the other protocols we talked about. They're using light therapy everywhere now. This one is the only one that goes directly into the blood. What happens is that on our mitochondria, which is the energy portion of every cell, there are photoreceptors. And the photoreceptors, when they're filled with the right light frequencies, they release an enzyme called cytochrome P oxygenase. And that stimulates the red blood cells to separate, and you have more exposure to receptors, and they're able to carry dramatically more oxygen. This tells you why the capillaries are on the surface, the very thin ethmoid bone. And what we're finding now in the new version that came out in the end of October, November, which is an A10 infrared, we're finding that sarcopenia is starting to get reversed. And so they're calling it, and I'm not. I hate that word. They're calling it anti-aging, but I'm calling it healthy aging because it's stimulating directly. It's able to go deep into the brain, especially with neurodegenerative conditions, and stimulate the release of those growth factors. That's the intranasal 810. There's a laser version, and then there's an LED version. You can see how it's targeted. 2 more minutes, okay. So the treatment of chronic disease, insomnia, cognitive impairment, Parkinson's, dementia, depression, post-traumatic stress, schizophrenia, stroke, migraines are all helped by this, and it's all documented in the literature. It affects your cells, the blood circulation. And you can see what happens with the red blood cells, how they look after a treatment. It's concentrated in the rich blood vessels. It's very small. You don't want to do it more than an hour a day, so our devices are designed to shut off at 25 minutes. More is not better. It's dangerous. The reason why, the way I taught it is that if you owned a parking garage and you used every inch to put cars in, if you try to push more in onto the photoreceptors, you'll smash up your cars. The same thing with the molecules. So it's designed for safety reasons to shut off automatically at 25 minutes. So you don't never want to go over 30 minutes twice a day. That's what it looks like. That's a 633. There's a 655 that we use for central nervous system disorders, particularly insomnia. And then the 810, which is the one I'm tending now to use the most. They're hard to get now. We use them in my practice. That's what's people with really severe conditions. A person that just wants to remain healthy, the LED is sufficient. And that's self-healing, removes the cause of illness, and that. Thank you. That's my office, and get them through. Any questions?